It's a pleasure to be with you today. Today, we are talking about the emerging technologies for diabetes management and our role as pharmacists, particularly as community pharmacists in the management of diabetes. As you know well, we are the core of the triangle between the patient, physician, and pharmacist, particularly the community pharmacist. But why we are the core communicator in the education, management, follow-up, and even the early detection and the referral of the patients? This has become as a result of that we are convenient products, we are distributed in every street and everywhere. Our services are free of charge and we are accessible throughout the day, 24 hours, 7 days. As I said, our service is always available as it's a free service. So we start with our patients in the process of symptomatic relief. If we are getting an alarm with the referral signs or symptoms, so we are going to refer the patient for the specific or the specialty of the physicians, even with previous diagnostic educations. Then the patients will get the prescription back to you. Your rule starts with dispensing and drug analysis, prescription analysis, that gives you an opportunity for dietary intervention with the nutritional supplements, which are the biggest arena that you can play in and to move freely with your patients. So if you get a full prescription analysis, you will get a good opportunity to get a high potential for the patient that to accept the opportunity of cross-selling with dietary modifications. And finally, the process of disease follow-up. As you know, most of the Oriental people are not keen for the regular visits of the physicians, and most of them get convenient with the regular monitoring with their near and trusted pharmacist. So to be successful pharmacists, we must consider 4 items. The first one is our attitude, which reflects in our behavior, just to be able to communicate well with most of people. Your interpersonal skills and intrapersonal skills that enables you to achieve your goals and to perform the best and the excellent performance with your patients and in your work or your job. Also, the process of knowledge, and finally, to adhere to the ethics of community pharmacy practice. Regarding the interpersonal skills, that you should be aware regarding the emotional intelligence, just to control your stress, to control the variety of the patient that you are dealing with. You should have a good communication skills to enhance your communication power. That will give you a higher persuasion potential. So this is called the persuasion skills, which is highly important regarding your approaches inside the pharmacy, how to promote yourself and to manage your time. These are examples for some inter and interpersonal skills that should be developed and to be always monitored. For the knowledge, we have 3 levels of knowledge. The first one is the pharmaceutical and medical knowledge, which is essential for the pharmacy practice, but alone is not enough. It should be mixed with the skills, as I said, and to watch your attitude and to adhere to the ethics. Another form of knowledge is the functional knowledge, which is related to your current job. Finally, the general knowledge. Today, we are going to have few tips regarding the pharmaceutical or medical knowledge, regarding the new and emerging technologies in diabetes management. So our contribution is diverse in pharmacy practice. Regarding diabetes mellitus, as you know well, it's an endocrine disorder characterized by persistent hyperglycemia with subsequent changes in lipid protein metabolism, which results from the impaired insulin release, impaired insulin action, which is known as insulin resistance, and the existence of an opposing factor, which is called the secondary diabetes. Regarding the Middle East and North Africa region and Egypt, we are talking about 463 million people that are documented as having diabetes in the world. 55 million of them are from the MENA region. And after 20 years from now, it's expected to be doubled. As I said, approximately 110 million people will be documented as having diabetes in the Middle East. In Egypt, we have 15.2% the prevalence of diabetes in adults. By the way, this is not a real or actual number. As you know, not all the cases are documented, so they are higher than this number. We are talking about documented 9 million diabetic patients. They may be the double number. This mandates us to be in a full alignment about the objectives of diabetes care. We have a rule in delaying the onset of diabetes complications. We have rules to ease the drug use to enhance the activity. We have rules to participate in improving the patient's quality of life. Also, we have a high rule in the compliance to the full treatment plan. Additionally, the dietary interventional plan. You are so close to your neighbors, you are so close to your patient, but you should do your homework just to be always updated, and also with the qualifications from the inter and interpersonal skills. You have a rule in the early detection, but first you should know the diagnostic criteria. I know that Dr. Ines talked about the diagnostic criteria, but please take care from the pre-diabetic person. The pre-diabetic person is the best one that you can interfere with, that you can refer just to return to the normal state. Also, be aware about the overweight, obese persons. They are at high risk to develop type 2 diabetes, or the females with polycystic ovary syndrome that you can detect them from their prescriptions. At this moment, they should be on insulin sensitizers or with dietary interventions to reduce their weight. The reduction in weight will affect directly the insulin resistance. Also, the cardiovascular patients, as you know, currently the current guidelines just from 5 years from now, started to give a higher priority for the anti-diabetic medications that have high impact to reduce the major adverse cardiovascular events. So the cardiovascular patients are prone for type 2 diabetes and will get high benefit from some anti-diabetic medications. The hypertensives, hyperlipidemic persons, and the persons with family history. Regarding the emerging diabetes technologies, diabetes technology as a term is defined from the American Diabetes Association as either a hardware device or a software that people with diabetes can use to manage blood glucose level, stave off diabetes complications, reduce the burden of living with diabetes, and improve quality of life. Actually, this definition is not comprehensive. From the comprehensive and the practical point of view, we can expand the technological solutions from being software and hardware only. We should start with the emerging technologies to enhance the drug delivery systems. Currently, we have oral GLP-1 analogs. Also, the development of the blood glucose monitors and their innovations just to help the patients for the regular blood glucose monitoring, as Dr. El-Berberi exhibited, that the use of the digitally bound or digitally linked blood glucose monitors was enable the patient just to reduce the HbA1c 2% than the regular or the traditional blood glucose monitors. Also, the softwares and applications, and finally the telehealth and education, which emerges in the last 2 years, starting from the lockdown due to the pandemic of COVID-19. If we start with the drug delivery system, vitamins now have been innovated to be delivered in a simplified form. As you know, most of type 2 diabetics have deficiency in B vitamin complex family due to the polyuria, particularly vitamin B12, especially if they are taking the metformin, as metformin chelates the vitamin B12 to inhibit its absorption. Additionally, vitamin B12 can affect the probiotics inside our colon, which have great role in the synthesis of vitamin B12. The bioavailability of oral vitamin B12 is not equivocal between the patients. Also, not all vitamin B12s are active. We are always searching for the biologically active B12, especially the methylcobalamin, the methylated cobalamin form. Currently, some formulations like the oral dispersible films are available now of vitamin B12 of the methylated form, the activated form, just to be applied on the tongue of the patient, that they give him a bioavailability equal to the parenteral form. Now we are talking about the patient convenience, to be convenienced better than being injected and to be annoyed. This is a part of our rule just to improve the compliance of the patient toward the medications and the supplements. Additionally, the enhancement in the oral delivery system of proteins, like the oral GLP-1 analog, which is the semaglutide that has been approved 2 years ago, which is one of the highly advanced technologies in pharmaceutical formulations that use the oral absorption enhancer, which is a polymer called SNAC, which enabled the semaglutide to resist the gastric pH and to get a higher oral bioavailability and to be effective for the management of type 2 diabetes as being add-on therapy with metformin. As you know, this family or the GLP-1 analogs currently on the top with the SGLT2 inhibitors in the guidelines for the management of type 2 diabetes to be add-on with metformin with their great impact to reduce the major adverse cardiovascular events. Additionally, the smart insulins that are acting in a glucose responsive model to be released from the site of being applied according to the change in plasma glucose level to prevent the fluctuation in blood glucose level. The prevention of blood glucose level fluctuation will enhance the quality of life of patient and reduce the HbA1c and the complications, either the microvascular complications of the diabetes. Regarding the blood glucose monitors, I think our rule as community pharmacists in the selection of blood glucose monitor is obvious, as most of patients come and ask us for what is the best blood glucose monitor that you have. Most of them going toward the offers and the price, but please always convert the features of the products into benefits. So you should consider the steps and ease of use, as most of the diabetic patients, particularly the elderly, are not familiar with the use of devices. The size of the screens and the digits to be clear for their vision, as you know, with the increase in the age and the chronicity of diabetes, will have a deleterious effect on the retina with the retinopathy and the impact also on the lenses and going toward the cataract. All of them will affect the visual acuity of the patients. Also, the time between sampling and strip allocation to give him a chance just to get the sample from his finger and to apply the strip inside the device. What about the chance for resampling, which is a very convenient feature, particularly for the elderly? Also, the accuracy and relevancy of the measurement enzymatic reaction, either being linked to FAD-H2 or to NADH+1, as if being linked to FAD, it will give him a higher colorimetric detection sensitivity, which is a part of the biochemical assessment of the effectiveness of the devices. Also, how the device will help the patient in the results interpretation as being metered, as being remarked, as being colorful. Also, the daytime of measurement, when to measure your blood glucose level. If you are seeking for a device that contains all these features, this is what's in Contour Plus One. Do you know the smart colors, as Dr. Ines talked and as Dr. El-Barbari talked? Most of the positive or the highly attractive features with good benefits for the patients are found in the Contour Plus One, particularly of being linked to a mobile application that can calculate the average blood glucose level over a week or over 2 weeks or over a month, just to produce a curve which is estimating the fluctuation, blood glucose level, and the monitoring regarding the medications and the patient adherence. For the softwares and applications, just consider the era of using a smartphone. 3 years ago, approximately 80% of the Americans were having smartphones. In the Middle East, approximately 73% of populations are using smartphones. So the calendars to remind the patient regarding the schedule of blood glucose monitoring, also the educative applications for the patients. This is our rule to direct the patient toward the most accurate applications. Also, some applications are of interest regarding the nutrition monitoring. Also, some giving dietary advices and dietary planning for the diabetic patient to help him control the glycemic index of the food and the glycemic load regarding the effect on the insulin level and the blood glucose level. One of the highly trending issue, which is what about the social media impact? Is it good or harmful? This is according to the direction of conceiving and being convinced from the information which is written or delivered through the social media, as anyone can initiate a page and to write any information and to be an influencer, to give them information. This information will be totally wrong or to be just his opinion. And now the medicine is evidence-based medicine. And currently we are in an evidence-based pharmacy practice model. So this is our rule to correct the information which is delivered through the social media and to help the patient to get the most optimum and correct and up-to-date and relevant information for his disease and for its follow-up. The newest era, which is the telehealth and tele-education, particularly for the elderly people, this was actual 3 years ago, but emerged more after the COVID-19, just to educate the patient, that follow its complaints and to assist him to adhere to their medications, particularly in the process of nutritional intervention and the use of nutritional supplements that could enhance the medication's effectiveness, use the insulin sensitivity to promote for cardiovascular health. All of these are our rules as community pharmacists. Even though still the diabetic patient has more help from all the persons related to the healthcare practitioners, as the diabetes is a multifactorial and chronic disease which is affecting most of our organ and the quality of life of the patient. Finally, we should always remember that our job is not just helping people to feel better, but to live better. Thank you very much for your attention, and thanks again, Essentia, for inviting me to join you. Thanks, Dr.